What is Sézary syndrome, and how does it correlate with hyperconvoluted CD4 positive T cells? Answer. Sézary syndrome is an aggressive subtype of cutaneous T-cell lymphoma, CTCL, distinguished by the widespread presence of hyperconvoluted CD4 positive T cells in the skin, blood, and lymph nodes. These abnormal T cells play a critical role in the development and progression of this malignancy, as they proliferate unchecked and infiltrate various organs, leading to a range of clinical symptoms. Associated facts for medical students. Clinical manifestations. Patients with Sézary syndrome often present with generalized erythroderma, severe itching, and alopecia. The skin may become thickened and has a leathery appearance. T-cell characteristics. The hyperconvoluted CD4 positive T cells are malignant and represent clonally expanded T lymphocytes. They often demonstrate CD7 and CD26 loss. Blood involvement. Sézary cells, which are atypical lymphocytes, can be found circulating in the peripheral blood. Diagnostic process. Diagnosis includes comprehensive examination of skin biopsy, blood flow cytometry, lymph node biopsy if needed, and correlation with clinical features. Lymph node involvement. Lymphadenopathy can occur, and lymph nodes may reveal effacement by Sézary cells. Treatment options. Treatment strategies encompass skin-directed therapies like phototherapy, systemic therapies such as interferons, retinoids, targeted agents like mogamulizumab, chemotherapy, and stem cell transplantation. Prognostic factors. Age, overall disease burden, and response to initial therapy can influence the prognosis. Prognosis, generally poor, with a median survival of 2–4 years, although it can vary based on staging and response to treatment. Epidemiology. Sézary syndrome is rare, mostly affecting adults over the age of 60. It represents around 3% of all CTCL cases. Association with mycosis fungoides. It's considered a leukemic variant of mycosis fungoides, sharing several genetic and clinical features but with a more aggressive course. Genetic insights. Recurrent genetic abnormalities such as TP53 mutations, PLCG1 mutations, and alterations in epigenetic regulation contribute to the disease's underlying biology. Impact on quality of life. Due to its aggressive nature and prominent skin symptoms, it significantly impacts the patient's overall quality of life. Further reading. For a more detailed understanding, students and physicians can consult reputable sources such as the WHO classification of tumors of hematopoietic and lymphoid tissues, the National Comprehensive Cancer Network, NCCN, guidelines, and peer-reviewed medical journals.